Hello and welcome to the third in our mini-series of podcasts about aortic dissection. Episode 1, we talked about what is aortic dissection. The second episode was about how you recover from it. And in this one, we're going to be talking about the psychological effects that it has on people who are suffering from aortic dissection and also for the other people in the lives of those patients. My name is Roy Sheppard. I'm joined by two former patients of aortic dissection. We have Edward Montgomery, who we call Monty, and also Martin Hilton. And we've also been joined by Mark Griffiths, who's a clinical psychologist at Liverpool's Heart and Chest Hospital, which is a centre of excellence for the treatment of aortic dissection. Mark, if I can start with you while we have you online, because technically it's a little bit ropey. So, Mark, can you tell us what impact does aortic dissection have psychologically on the person and also those in their lives? I can imagine it is pretty traumatic.
Yes, definitely. Let's start with the individual themselves. Obviously, it depends on the type of dissection, but certainly for a lot of people in one category, say type A, then it becomes a massive shock out of the blue. It can be very serious, and the first person's awareness of it can be when they wake up following the medical consequences of the dissection. And it can feel absolutely life-threatening and hugely life-changing. In terms of that sort of circumstance, trauma is a common consequence, as you would imagine. A huge sense of change of the way you look towards the future, and a huge amount of adaptation needed in adjustment to having to live your life completely differently following survival and dissection, where a lot of things you would have taken for granted and done without thinking you can no longer do because the medical advice is don't do this, don't do that, because of the risk of further medical consequences. So in terms of the anxiety, the sense of change for the future, for some people it'll lead to hopelessness, and then you're into the realms of personality difference. Some people will be able to respond to these changes and assimilate these things and try and get on with things quite naturally. For other people, it'll be a catastrophic sense of change and loss of personhood, of self, of confidence in relationships, everything they would normally do. The other experience, I suppose, from an individual point of view, will be some people's experience of dissection. It can be less immediately sort of hugely life-threatening, and they might go to A&E and get sent home again, being told, actually, it's X, Y, and Z. It's not dissection isn't thought about at all. And they go around living their lives, go back again, and one way or the other get diagnosed with a dissection. And that can be a really huge shock. The consequences then again are sort of defined by personality difference. But again, I suppose all I'm saying is, obviously the life-threatening part, if you sort of, some of the people I've spoken to as patients who experience dissection can literally, their experiences, they literally drop dead and they wake up in hospital days later, have no idea what's happened, and their family has witnessed that, and that's got a huge impact on all of them. Other people it's different. But whatever your dissection experience, the life impact can be immeasurable. And I suppose it's important not to sort of assume that, oh, well, the life impact can't be that bad because that didn't happen to you, that happened to you. It all really depends on the person's experience and how they were before. With pre-dissection, everyone's different. People may have struggled with other psychological issues, mental health issues, other life events, other illnesses that will have an impact. Or they may have family members that have died from a dissection or have struggled to recover from a dissection. So for them, surviving it, will be influenced by those wider factors. So it can have a huge amount of impact.
I know a number of people who've faced death and have had, massive trauma. But interestingly, some of them have actually been very pragmatic about it. And it's not them who have the problem, it's the family. It's the partner or the children or whatever. What advice can you give for people who have a close family around them and, they have responsibilities, they have financial responsibilities, they have emotional responsibilities to their partners? What do you say to those people who fear the worst? And it's very difficult to have logical conversations when people are undergoing those sorts of depth of feelings.
Yeah, no, it's difficult, isn't it? And again, if we start from the personal point of view, the dissection survivor, they might not want to share how things really are for them for fear of how that will affect their loved ones, for fear of burdening them, for fear of embarrassment. Am I, should I be coping better than I am? Or so they may hide a lot of the feelings that they're struggling with. And on the other hand, you might have the family members who really find it difficult to negotiate how to find out they really want to know, and they're really worried about their partner or daughter or whatever, or parents, but they just don't know how to get into that conversation. And so there can be a lot of unsaid stuff, which makes things more difficult. And it's just that uncomfortability. So I know a lot of patients I've spoken to, there's a lot of overthinking naturally about they're worrying about the impact on others. So there's a burden of feeling for many people. I have to cope. I've got to keep all this in. And a lot of self-critical thinking really in terms of their own, how they feel they are coping. And when they can open that up and when they are able to sort of get over that, either because the other family member is like, look, just how are you? It feels a more open, allowable conversation. It can be a big relief to sort of release some of that, but it can be quite difficult sometimes, because obviously, as I say, because the very essence of people caring about each other so deeply can be a block to talking about either one's feelings.
So this stoicism is very much a male trait.
Can be, definitely.
Do you find that it happens more with men? Monty, yes. I'm going to come to you in a second, because I know that you've got specific experiences of this thing.
Yes, I mean, like you say, absolutely right. Stoicism tends to be a more common male trait, and men tend to sort of internalise feelings a lot more. Women tend to talk amongst the friends, family, more than men do. Men tend to sort of bury feelings and sort of try not to sort of recognise them, because they're difficult, and there's a lot more shame often in terms of, I should be coping better, I shouldn't have these feelings. It's there's a lot of self-judgment. But in terms of the advice, it's again how to sort of loosen some of this stuff up. Really, if you're a family member of someone that's survived a dissection, I suppose the first bit would be, obviously you're going to be caring about them, but it's sort of trying to assume what their experience might be, and just make it known to them you're there to talk to them, to listen, however that's useful. It's difficult for family members. Obviously, I've got my own family. If I can put myself in this situation, I've got children. Do you know what I mean? If you're caring and worried about your family, that's your partner, your children, your parents, or whatever, it's easy to sort of go in there with your own worries and your own needs about to get your own certainties and own reassurances, which, like I say, can sort of bring these blocks up and put people on the spot and make it difficult. But it's making your family aware that you're there for them if they want to talk about stuff often will be enough. So just freeing that possibility up. I don't know what you think, Martin, Edward. You can tell me, but
well, Monty, you have a young family and a wife. How did you cope initially with it? Because anybody who's listened to the other podcast knows that you had amnesia for a couple of days and you weren't actually aware of what had been going on, but the reality must have sunk in pretty quickly. How did you juggle all of those responsibilities, if you like?
Yeah, when you talk, it was interesting when you talk about being pragmatic. I mean, I was in the hospital, had to wake up and deal with it. It's just the total change of reality was that's what I had to deal with, and that was, I suppose, a very personal thing. And obviously I was on a lot of drugs, and I didn't know what an aortic dissection was. So I think personally I just had to really just pragmatically, persist, I suppose, and just really dig deep, because it was quite, for that first week was pretty harrowing. I mean, I had a collapsed lung, and I, couldn't breathe properly, and then tubes everywhere. So, I was in a ward, and someone died on the ward. And so, this whole, quite grim. And then obviously my wife, she had to experience it, right? An emergency going from, on a Monday, and then she's in hospital, and then she had to deal with everything, like a whole, sort of life, changed in a very, within a day. So I think, I just sort of had to dig deep personally for that first week. And I think for my wife, she just had to hold on, we had kids. My work at the time was very, you know, adaptive, and I could just see a lot of ripple effects. But I think for my wife, it was different. I mean, we can talk about, you know, PSD. I had to actually go back to 2 years later to have another open heart surgery. So that's another thing. But
was that easier or worse?
Easier, worse. Well, I mean, Martin might talk about it. I mean, it was my worst nightmare to have to go back and do a second one, to be honest, because I had the experience of the first. But I'd learned a lot, and I was a lot more pragmatic. And I when I heard about the second one, it was on a Wednesday, and then my wife's 50th was on the weekend. So I held on to that news for like 6 days, or no, 5 days. Didn't tell anyone. Was it worse? It was worse initially. For about an hour. I was really like, you know, I'd done a lot of work. I'd taken all the pills. I'd done a lot of yoga. I was thinking I was going to see the doctor and be told I was doing well. And then he said, you need to sit down, because I had one of my, the veins, there was a small bleed, and they had to go back in. So I think personally, was it worse? It was my worst nightmare, but actually when I just sort of sat back and accepted it, and I found a solution, you know, I got through it. Although I would say when I was in there, you know, there was 2 or 3 days really depressed because I came out of the situation off the drug. So I think that was difficult. But I think the lessons I learned from the first one, I knew exactly what I was going through, and those type of things. So I think the lessons were, you know, you just have to get through it. You have to find a way. And I think, and we'll get into what it does for your family. I think for my wife in particular, you know, she had a bit of PSD also had a stroke between that. So she had to deal with that. Talking with your kids. We had the thing I called CT time, like chat time. So they could ask me any questions. And my eldest daughter's probably been impacted by it most because she's seen it the most. So we still talk about it. I think being quite open and chatting to them, you know, especially young kids in particular, is interesting. But I think for the wife or the family, you know, they probably need a different thoughts than what I did. I didn't actually really need a psychiatrist. I was a bit more like, you know, I've got this. What's the way forward, really? Whereas for my family, it was more psychological issues they had to deal with.
Martin, your situation was different. That your wife was with you when you sort of fell victim to your aortic dissection. Let's talk first about how it affected you psychologically, and perhaps we can expand it out then for your family as well. So what about you?
So I think similar to Monty in many ways, I had a very pragmatic kind of approach to it. So once we'd gone through the diagnosis and been told it was aortic dissection and asking, you know, what's that, you know, not knowing anything about it, and then realizing that, you know, surgery is, you know, necessary, and it's necessary now, and it's going to be open heart surgery. You have all those little sinks, but it's like, right, let's do this thing, you know, let's get in the right mindset. I remember even being when I was being anesthetized, I had positive affirmations going through my mind. Now, did that make a difference to the surgery or my recovery? Maybe not, but you know, it was worth doing, you know, and I think my reaction to sort of waking up after surgery and realizing I was waking up when I was so full of elation.
Temporary, or did that last?
No, it lasted quite a long time, to be honest. And I think it's underpinned my mindset definitely, because, you know, I didn't want to not live, you know, had a lot more life to have and give and all the rest of it. And, you know, lovely family. And so most of my time, I think, post-op has been, pretty positive mindset. If I do get myself down, I tend to reflect back to that time when I came round and the joy I felt about being alive. You know, I mean, it literally felt like, I know there's the phrase born again in a Christian sense. That's not really what I'm referring to here, but literally seeing the world through new eyes was just wonderful. So I try and take myself back to that. I would echo Well, I think, and listening to some of Mark's observations there about personality change potentially, I think that has happened. I think probably my ability on emotional control is different. So I get emotional a lot quicker and more frequently than I probably did, but that's probably not a bad thing in many ways. My stress tolerance and stress coping mechanisms are probably not as effective as they were. So, I think there has been that sort of impact, but I'd echo probably what Ed suggested before, that probably the bigger impact for me is vicariously through Fiona, my wife, and my daughters, and I see the stress and what it's caused them.
So what did it cause them? I mean, how did they deal with it?
Well, I think, so Fiona was with me when I was going into surgery, as was Ellie Rose, one of my daughters. My other daughter was several hours away, and we actually, I remember having the conversation with her on the phone, just saying, I've just got to go in for a short procedure. And that was hard to lie to her, but I didn't want her stressed, 2 hours away and then rushing to get to me or anything like that. So that felt tough, because at that stage, these were phone calls and these were potentially last words if surgery hadn't gone well. And then I spoke to my other daughter, bless her, Ellie Rose, and these were, potential goodbyes. But again, my mindset was of as such that I didn't accept that as a likelihood at all. But potentially they were, and I felt and still feel tough with the conversation with Ellie, because you're saying goodbye potentially to your dad, it must have been so tough. And I asked her to have a conversation for me with Beth, who was the daughter that couldn't be with us, just in case things didn't go as we hoped they would do. And I wanted Beth to know certain things. And so putting that on Ellie, I know, was probably quite a burden. And so she had to live with that. And both Fiona and Ellie, of course, had to live through my surgery, whereas I had to live through it, but I wasn't conscious. So as soon as I was knocked out, that was me for 14 hours. They had those 14 hours waiting to know if I was gonna come back and see them.
What have they told you since? Because it happened to you just before the outbreak of COVID, so it's a few years ago now. What are their recollections and what are their insights that perhaps surprised you?
The story I've just told about Ellie, I was surprised that had the impact, and probably a bit selfishly, I suppose. I was surprised that had the impact on her that it did, because I thought I was being quite sort of pragmatic. Look, if things don't go well, will you have this conversation for me with Beth? But looking at it, from a distance now, I suppose that was always going to have a big impact. But I didn't really see that so much, and I think. Funny enough, I just felt very pragmatic about the whole solution. And it's crazy to think, you're staring death in the face, but actually it didn't feel too unreal to me, which is kind of reassuring in a sense, because there's only one thing that's sure: we're all going to face that at some point. But for them, looking at the loss of a loved one, I just think it's probably it's worse. I mean, gosh, I'd rather go myself than lose one of them. So I can kind of understand it, and I think particularly with Fiona, Fiona had to go through this massive balancing act then.
Because life still goes on, and she's still got those responsibilities.
Looking after the girls, trying to look after me, trying to keep all the plates spinning, and I think that was massive stress for her. And I think we spent a lot of time in subsequent weeks and months after the dissection, talking about it. We'd talk about it, Fiona and I, and it would get quite emotional. And when I sensed we were getting into conversation, there was part of me that, I really just don't want to talk about this anymore. I'm just fed up with talking about it. But I realized that for Fiona, it was critical, for her to talk it out, to be able to talk about it and to talk about her feelings. And one thing she did do, she started calling some friends. We'd agreed as I was going into surgery who we wanted to let know was going on, and chose people specifically, I suppose, that I knew could help Fiona as well. So all of a sudden sort of start to share that burden a bit. And I think, what I've heard about those initial conversations has been just incredible, you know, how much emotion and stress there was when she phoned some of my friends who then, in supporting her, allowed Fiona to sort of scream out, basically, you know, and that sounds like it probably helped.
Monty, what did you hear there that echoes with your own experiences at home?
Yeah, I mean, I resonate with those. I think I sort of go back to the point that, you know, your close families, I think I'd echo what Martin says, almost more harrowing for them was what the sense is what I had, because it's something I had to deal with on a medical basis, take my medicines and get through it. Yes, there's psychological issues. I'm not saying there's not for me, but I think for them, like when I had a stroke, when my wife had a bit of PSD because she, you know, I collapsed and she actually had to take me to the hospital herself, like take me down with my neighbor. And, you know, I'm a 6'3" individual, put in the car. The last thing I remember is and she drove to the hospital because it was quicker and I got operated on very quickly. And there was no ramifications of that. You know, I came out of that quickly. And that was because of complications with the heart and everything. But that, you know, I came out of, that was an hour surgery. But I mean, I'm very lucky. I had no abnormalities of that. But the effect on her, I think, for that was quite material. So, you know, she had a, you know, PSD. So she had sort of some more therapy on that basis. So I would just sort of echo, you know, make sure you're in discussions with your loved ones. Obviously you are, but their needs will be probably potentially different to yours.
Okay, if I may, I don't know whether I should recall this, but Monty, you did say to me that you had one issue of not taking your medication at some point.
Yeah.
What was going on in your head about thinking I don't need to take my medication, because you paid the price, didn't you?
Yeah, I wouldn't say I didn't take the medicine, Roy. I was just not as
fastidious
or, you know, militant on taking your warfarin. I mean, I've never had to take it. I mean, I take a vitamin pill, right? So you get out of this aortic dissection and you've got an artificial valve, which means your blood's always trying to clot and get rid of it, right? So you then obviously being distributed warfarin, which is a blood thinner. And then I was also, or post this, given aspirin, which I always thought was for someone older, right? But anyway, so you need to take this each day, otherwise you can have a clot and then you will have a stroke. So yeah, I mean, in August 2023, I had a sort of an ITL, or like a mini stroke, where my speech, I was there in France with my kids, and I couldn't. My daughter was talking actually about sharks, weirdly, and I could hear her talking about sharks, but I couldn't verbalize it, and that was a sign. Anyway, I was in France and I went away, and I had an ITL mini stroke, which I had to sit in the hospital for a week. But because I didn't take the medicine, right? I didn't take the medicine militantly.
What was the psychology going on there, though, about you're not taking it militantly?
Well, I felt good. I mean, I felt weirdly like it almost could run another marathon. I mean, I was taking tablets, but it wasn't. I don't know. I think psychology is like, well, this is working. And I knew I had to take them, but I suppose that was the lesson, if I'm sharing with people, that there are certain medicines, obviously like this, that you have to take religiously. And then, so it is probably stupid, but, you know, and the other lesson is also I then had to take aspirin. So that's something I took.
Mark, welcome back. We did lose you.
Yes.
You must have experience of patients who are given medication, they're given a pathway, and they don't follow it for whatever reason. What advice would you give to somebody who's going through a very serious situation and feeling that they can't cope with, you know, whatever they're being told to do?
Difficulty with any sort of, but basically after dissection, you're living with a long-term condition, aren't you? You're living with something with long-term health effects, like lots of other long-term conditions. So you mentioned Monty, stroke or whatever, you know, they're all sort of lifelong conditions, but the consequence you live with. And it can be difficult coming to terms with that you say you have to live differently, and whether it's taking ongoing medication, whether it's avoiding high levels of stress or whatever. So one of the challenges is you can end up, if you responding as pragmatically to the experience that you both have can be very difficult to people. Do you know what I mean? So it's important to try and carry on finding new routes to do things to meet the values that are important to you, whether that's family connection, whether it's challenging yourself, whatever it is. So say, I don't know, say you used to like rock climbing or whatever, and, you know, following dissection, they're like, you can't be doing that. Do you know what I mean? So what was it you got out of it? So I'll give you a strange example. It's got nothing to do with dissection, but it's the theme that I'm talking about. So I've worked in lots of different areas over the years. So I used to work in amputee clinic. So, you know, I've got a guy, an engineer, who used to, you know, was he an engineer, work with his hands, fix things. They lost an arm. So he couldn't do his job. He completely lost his purpose, lost his role that he trained for, whatever. And one of the first things I got him to do, as amongst all the other sort of getting to sort of recognise himself, he ceased to recognise who he was, all the stuff that can be a challenge following lots of things like including dissection. But anyway, I got him to basically, it's going to sound a bit weird this, but not the first time I met him. Within a few weeks, I got him to buy a bookcase and make it in one arm. And then saw him and said, it's going to take you longer than you expect, but I want you to do it. I can't do that, I can't do that, I can't do that. You can, but it's going to be difficult, but I want you to do it, and I don't want you to leave that room until you've done it. It wasn't in a hospital, this was at home. But anyway, it took him way longer than doing it. It took him about 6 hours to complete it. It was not quite as perfect as it would have been before he lost his arm. But by doing that, when I saw him next, he proved to himself, my God, I can make a bookcase with one arm.
But isn't that the mindset thing where, you know, Martin talking about his positive affirmations of saying, I can do this. When you're talking about amputee, I've got a very dear friend of mine who's quite well known called Chris Moon, and Chris Moon got blown up and he only has one arm and one leg. The stuff he does is absolutely unbelievable because he refuses to accept that he can't do something. So it is about that mindset, isn't it?
And sometimes it's say for some people it's naturally you can get into that. I've just got to get on with it. I've got to do X, Y, and Z. For some other people, they've got to go through an experiential process to get to that point where they think, I can do this. I can get through this. And then it's an ongoing. It's not a suddenly fixed thing, as you both know, Monty, do you mean? But it feels doable then, and you got to carry on. But there can still be frustrations in terms of I've got to take this, I've got to take that, I've got to take the other. They can still, but it's an ongoing challenge, isn't it? Because you've got to live your life differently on various ways. Do you mean you can still get value out of life? And again, without going into examples of my amputee patient, he did lots of things that challenged him, and he ended up doing things that he could never have done if he hadn't been an amputee. They were really meaningful to him, and he really gained a lot from. Doesn't mean he liked the fact he was an amputee, but lots of things happened after that were really valuable to him that would never have happened. And it's sort of it is how you can assimilate all this stuff, and it can be difficult. Do you know what I mean? But I'd say it's all part of really following dissection. It's that sort of what are the steps to help you adapt to look at rebuilding your life basically in a way that's valuable and meaningful to you.
All right, Martin, can we go back to an issue that we haven't touched on at the moment? We've talked about family, but work is a critically important element that's linked to family. How did you deal with the work side of things?
Yeah, great question. I was so lucky in a sense that lockdown happened. And so reflecting on it, you know, particularly the sort of type of person I am, I think I would have rushed back into work probably too soon. So, but because of lockdown, of course, everything stopped. I was furloughed along with half of the population. And so it gave me time to reflect and to go through that recovery stage, and then to start thinking about, well, what can I do? What do I want to do with my career? And I'm still sort of going through that phase now. I'm quite happily kind of still in the weeds a little bit, but that's not because of so much aortic dissection, I don't think. But
that's real life.
It's real life, and it's kind of life stage, you know, and I'm kind of that phase, you know, do I want to retire? Do I not want to retire? Do I want to semi-retire? What does it all mean? What do I want to focus on? I think what it's done to me in a sense, it has brought a greater sense of mortality and in my mindset, although I'm still hugely positive, I do find myself thinking about the next 10 or 15 years, and almost not wanting to put a cap on things, but thinking, crikey, 15 years, if I can remember 15 years ago, it's so easy, to think what happened 15 years ago, and to think, well, I might only have maybe that length of life left or something of that. You just don't know. And so that's sort of impacted me a little bit to think, well, if that's the case, do I want to spend the next 10 of those 15 working? And the answer to that is probably not. So it's making me focus more on the things that I want to do and be a bit more.
Isn't it ironic that it takes a life-changing experience such as this for you to get back to the basics of what is your life actually about? Yeah. Monty, in terms of work and that side of things and responsibilities for young families and stuff, how did you deal with that?
I think it was a big thing, particularly when I came out, I was an exec and I was on doing, big things with a listed company. And I had to really, that was a big thing for me. I was like, wow. But work at the time were very, very good, and I had time off. And then they took me off all the stuff. So I had that sort of ability just to sort of 3 months off really to get back into it. But then I, got recovered and I came back. I think it's a big thing. And I suppose, like Martin says, I'm a lot more aware of time, i.e. how precious time is. I know that's, again, I don't like wasting time on stuff. And when I say wasting, I can waste time or it'd be, sport, but, I'm very sort of, I don't want to waste time with people I don't want to be with or work or stuff like that. So I'm now really a lot more conscious about, as Martin says, I've got, 20, 30 years left. I want to make it productive. So I'm a lot more conscious of each day and what time I'm putting my mind to and where I am. But I think I think finances and family in particular, when you've gone through this, is a big thing, and you've got to talk to your firm or talk to your family and try and work a plan. I suppose I am in a bit of flux on that right now, but in a good way, because I'm outside of a company that I was involved in before and moving to do things, but it's definitely an issue you have to deal with.
All right. What advice?
Roy, can I just dive in on one quick point, just to echo something that Monty said there? So before I was anaesthetized, and this, I don't want this to sound bigger than it is, but before I was anaesthetized and you're thinking things through, the one thing I never thought anything about was work or money. It just didn't feature. It's about family, and it was about love. And I know that don't want to make that sound bigger than it is, but
that's huge. So
I know it's massive. I suppose so. But I suppose that was my lesson, that if I need to know what's important in my life, I just kind of can think about that. And it's the love and it's the family and actually work and money. And I'll probably say this glibly because we've done okay, and I know some people suffer hugely, but I kind of have a bit of the mindset that they tend to work themselves out, so I'll focus on the family and the love, I think.
Okay. So guys, what advice would you give based on the fact that you've been through some very traumatic experiences? What advice would you give to people who are facing aortic dissection recovery about the psychological effects of it? Monty?
Why don't you go first, Martin? I want to hear from you.
Cool. Bizarrely, I would say embrace it. Neither Monty or I had a choice whether we were going to have the operation and had to go through the recovery. I know there'll be a lot of people hopefully watching this that maybe are due an operation and not in an emergency situation, or maybe some people are just recovering and have just had their operation. So I think embrace it. And Monty and I spoke a couple of days ago, and I actually asked Monty, and I'll let him answer it in a minute, but I asked him, would you change it? If you could go back and change it, would you change it? Because I've thought in my life, would I change it? And I kind of go, probably not. I'm not, it's not framed me in any different way, perhaps, than I would have been anyway, but it is just life. And I think my best advice would be to that find themselves in the situation, grab it, take responsibility for it. The medical support we have in the NHS is just absolutely wonderful. But as a patient, you need to play a big part in that, and not just do what you're told, but also ask questions and challenge nicely and professionally, to get the best outcome. So I think, embrace it, see it as a journey. One of life's rich journeys, I guess, which sounds
hell of a journey. Monty, have you had time to think of something now?
Well, I was thinking, but I just wanted to hear Martin. I mean, I talked about it before, like fall in love with reality, which is what Martin's saying. Like, that was the lesson from the first one, and I'm not saying I accept it, but I accept the reality of what had happened. Right? It doesn't mean I stop, but so there was that. Per what Mark says, for psychologically and also physically, you need to find a solution that works. So I was always the mindset, I'm gonna find a solution. So have a solution mindset, both physically and mentally, to change your pattern, because you can continue to have a successful, healthy and family and career path, I think, but just need to make some adjustments. So just find those adjustments that work, and also make sure that your family has care and support that they need, because they will probably need, as we talked about before, different requirements, which is definitely what's happened with me. That would be probably the one things. I mean, take your medicines. I know that. One thing I would say this thing is, I don't know, Mark, but this thing is an INR machine. We haven't talked about INR, but that's something I got, and actually in France they give out.
Can you explain what it is? Can you explain
it? It's basically a home testing kit, which I would recommend. Anyone's going through this should have it, because that. Yeah.
So you're saying become more engaged in your own health, and this is a demonstration of you are now far more active in your own health and future. Yeah.
Okay. Monty with his INR story. So when Monty and I first spoke a few months ago, it was great for me, because I've always wanted to get off all my medication, and the only thing that was lasting that I'm still on was warfarin. So it kind of played through my mind a couple of times. Should I just stop this? But then hearing Monty's story, it's like, nah,
maybe not.
I'm sticking with it.
Yeah.
All right. Well, can we turn to the clinical psychologist for the final comments? Mark, can you just give us an overview of tips that you can share based on the many different types of patients that you've had to deal with in a professional capacity?
Yeah, sure. I mean, the first tip would be, I said before about how one of the natural responses to things is not wanting to share feelings, whether it's to do with shame or just finding it difficult to express or worrying about others. Try and get past that and talk to those that you're close to, that you're going to help each other basically by talking. Conversely, by talking to those that love you, you're going to help them understand and help alleviate some of their anxieties, as opposed to adding to them, but you're going to help yourself as well. So getting past all that unsaid stuff that can make things more difficult can be a barrier. That's definitely something that can help. Martin and Monty, you said it, reprioritising things. Adjustment basically isn't about passively accepting, oh well, this has happened to me, that's it, isn't it? That's I've got to sort of withdraw and live safely and all the rest of it, or whatever. It's about readjusting to your expectations of life ahead, and making changes of what's important, reprioritising. You said, Martin, looking at things that what's most important to me now. How do I want to live the next 10 years? Basically, none of us know whether we experience something or not. None of us know what's coming in the next few years.
Yeah,
that's what life throws at you, whether it's a health event or it's an accident or something, and that's just what we live with. We've all got our plans of where we think we're going to be in 10 years to a degree in the back of our minds, and lots of things can happen to change that. So when something happens like this, just look at what's important to me, and try and follow that line as best you can. But it all sounds very simple, do you know? But using support around you. one thing we haven't got always in the system, that there are, dissection patients do have a lot of ongoing support from medical teams and the rest of it. Even if there's not someone like me in those teams, there'll be nurses there that can be talked to get support from. There's helplines out there. There's, you can, even something like the British Heart Foundation, it's not aortic dissection specific, but they have nurses at the end of the phone you can talk to about your experience and just get a sympathetic, understanding ear about, to get things off your chest and realise actually what you're experiencing is quite normal. And then you can get through that and look ahead. But use what's around you, to the support that you have, the family support and friendship circles people have will be different with different people, but generally there are support networks out there you can engage with that can help you sort of move on the way that you'd like to.
All right, and there's the Aortic Dissection Charitable Trust.org as well,
Yep.
Obviously. Can I just say thank you so much, Mark? You're in Liverpool, and listening to you just now, I thought to myself, the John Lennon quote was so appropriate. Life is what happens when you're busy making other plans. So that, I think that applies very, very well here.
Yes, absolutely.
Mark, thank you for joining us twice. I know we've had a few technical issues, but it was definitely worth you being here. And can I also give a very special thank you to Martin Hilton and Edward Montgomery. Guys, you have been stars for these last 3 podcasts. You've really opened up. You've been very generous and very candid about your experiences. So on behalf of all the listeners and the viewers of this in the future, thank you so much. It's been absolutely great. That's all from us. I hope you found this series of podcasts to be helpful, and good luck with the future.
Thank you. And thank you, Roy.
Thank you.
Thanks.